Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
The September issue of the journal highlights recent advances in the epidemiology and treatment of psoriasis and hidradenitis, suppurativa HS. New data refine psoriasis, prevalence and incidence estimates, and underscore ongoing sex and age-based disparities in disease burden. Novel research suggests that the onset of psoriatic arthritis relative to skin symptoms may be more variable than traditionally believed, emphasizing the need for early rheumatologic screening. Emerging results indicate that subcutaneous methotrexate is a promising alternative to oral therapy, offering improved bioavailability and tolerability. In HS, lesion location is linked to disease severity and treatment choice. An elevated C-reactive protein is proposed as a practical marker to screen for coexisting inflammatory bowel disease.
An open access commentary by Shanad Szabo discusses epidermolysis bullosa, a rare skin disorder that causes extreme skin fragility and leading to pain, limited mobility, social stigma, and psychological distress. The author notes that patients often struggle with feelings of exclusion, dependence on others, and challenges in leading a normal life due to the constant risk of skin injury. To support well-being, guidelines recommend planning, relaxation techniques, social inclusion, and psychosocial support for both patients and families. Szabo highlights how the EADV task force presents a holistic approach to care, emphasizing age-appropriate quality of life assessments and interventions that address biological, psychological, social, and spiritual needs.
Viguier et al. Contributed to this month's issue with a comprehensive literature review evaluating the use, safety, and efficacy of subcutaneous methotrexate in the treatment of adult patients with moderate to severe plaque-type psoriasis. Methotrexate, known as MTX, is a conventional systemic therapy widely used to treat chronic plaque-type psoriasis, a chronic inflammatory skin disease that significantly impacts patients' quality of life. MTX can be administered orally or subcutaneously. Over the past decades, the use of subcutaneous versus oral MTX has been a subject of ongoing debate among dermatologists. Therefore, this literature review aimed to investigate the differences between oral and subcutaneous MTX described in the scientific literature in terms of intestinal absorption and bioavailability, efficacy, safety, patient satisfaction and quality of life, treatment adherence, and economic outlook. 32 articles were included in the review, notably including evidence-based guidelines on the management of psoriasis, as well as randomized clinical trials and real-world studies. Only European guidelines recommend the use of subcutaneous MTX over oral MTX. Hence, the use of subcutaneous MTX is reported almost exclusively in European countries. Despite the paucity and heterogeneity of the literature, findings from the review suggest that subcutaneous MTX may overcome some limitations of the oral route in terms of intestinal absorption, bioavailability, and safety. Moreover, subcutaneous MTX may provide higher efficacy with a faster or even greater response in psoriatic patients and better adherence to treatment. In conclusion, subcutaneous MTX tends to be advantageous with regard to psoriasis management, similar to other chronic inflammatory diseases like rheumatoid arthritis. However, this comes with a higher cost. The authors deem that the treatment of psoriasis using subcutaneous MTX deserves further study, especially in the biologics age.
A related commentary by Laura Kiss and Roland Gulai provides further context on methotrexate as a long-established and widely used treatment in dermatology for immune-mediated inflammatory diseases. Its immunomodulatory effects are now mainly attributed to adenosine signaling in JAK/TYK inhibition, though its mechanisms are still not fully understood. Recent evidence shows that subcutaneous methotrexate offers superior bioavailability, efficacy, and tolerability compared to oral forms, yet it remains underused globally due to cost, patient hesitancy, and lack of unified guidelines. The authors mention that in order to reduce risks of overdose, especially with oral methotrexate, strict adherence to EMA safety measures, proper patient education, and consideration of subcutaneous administration are recommended, particularly for older patients or those with comorbidities.
A systematic review by von Daniker et al. Summarizes clinical outcomes and prognosis in atypical fibroxanthoma. Atypical fibroxanthoma, or AFX, is a rare dermal spindle cell tumor characterized by a generally benign clinical course. Despite recent advances, there are still challenges regarding its accurate diagnosis, prognostic indicators, and optimal management strategies. This paper aimed to evaluate recurrence rates, identify prognostic factors, and provide evidence-based insights for managing AFX. The authors systematically searched the PubMed, Embase, Web of Science, and Cochrane databases following PRISMA guidelines. Observational studies published from 2002 to 2024 that confirmed AFX through histopathology and immunohistochemistry were included. Recurrence rates and prognostic factors were analyzed using a random effects model with inverse variance weighting. Sensitivity analysis assessed heterogeneity, while publication bias was evaluated via funnel plots and Egger's test. 8 studies involving 1,366 patients were analyzed. Patients were predominantly elderly males, 78.9%, with an average age of 76.9 years, and lesions mostly in the head and neck region, 89%, measuring about 14.9 millimeters in diameter. The pooled local recurrence rate was 4.73%, while the metastasis rate was 0.59%, and disease-specific mortality was 0%. Strict adherence to standardized diagnostic criteria results in low recurrence rates in AFX, reinforcing its predominantly benign clinical behavior. Thus, the authors highlighted the importance of maintaining strict diagnostic standards for AFX to ensure accurate patient prognosis.
Our next section includes an original article by Bartoszyńska et al. On the epidemiology of psoriasis in Poland, delving into its prevalence, incidence, and mortality rates. Although the data on psoriasis epidemiology included in the Global Psoriasis Atlas provide valuable information on psoriasis prevalence worldwide, the database is still incomplete. Therefore, the aim of the current study was to assess the prevalence, incidence, and mortality rates of psoriasis and its types in Poland based on the data registered by the National Health Fund. The study included psoriasis patients registered at least twice in the Polish NHF database between 2010 and 2023. At the end of 2023, 639,662 living psoriasis patients had been registered in the Polish NHF database, which constituted 1.7% of the Polish general population. The percentage of female psoriasis patients was found to be higher at 54.95% than male patients, who represented 45.05% of the cohort. Of all the Polish NHF registered psoriasis patients, plaque psoriasis affected 95.66%, pustular psoriasis 3.05%, psoriatic arthritis 7.20%, and gudate psoriasis 0.27%. In comparison to the general Polish population, psoriasis prevalence was observed to be lower in children, specifically 0.84%. The all-cause mortality rate among psoriasis patients was found to be higher in comparison to the general Polish population, with a higher mortality rate noted in male psoriasis patients. The NHF database the authors studied suggests a direct relationship between the prevalence, incidence, and all-cause mortality rates in psoriasis in patients' age and sex. However, the study also revealed a decrease in mortality rates and a slow increase in the prevalence of psoriasis in the Polish population, which calls for further studies.
Among our September papers on inflammatory diseases, a cross-sectional cohort study by Ogud et al. Examined serum C-reactive protein as a potential indicator for screening fecal calprotectin in patients with moderate to severe hidradenitis suppurativa. HS is a chronic inflammatory skin disorder frequently associated with immune-mediated comorbidities, including inflammatory bowel disease, or IBD. Given the potential risk of IBD, particularly before initiating therapies such as IL-17 inhibitors, screening through a fecal calprotectin test may be warranted. While FC is a reliable, non-invasive biomarker for ruling out IBD, its cost and limited availability in dermatology settings present challenges. Therefore, the study aimed to investigate the potential association between FC and serum C-reactive protein, or CRP, levels in patients with moderate to severe HS, which may provide a more accessible screening approach. The study was conducted at the Department of Dermatology and Venereology of Ushak University between April 2, 2024 and December 31, 2024, including 18 to 65-year-old patients with moderate to severe HS. Serum CRP and FC levels were analyzed using ELISA. Stool samples from 61 patients with moderate to severe HS were included. The median FC and serum CRP levels were 28.2 micrograms per gram and 5.3 milligrams per liter, respectively, with a significant correlation between them. While FC levels did not significantly differ between moderate and severe HS, CRP levels were significantly higher in patients with severe disease. Receiver operating characteristic analysis identified a CRP cutoff of 5.35 milligrams per liter for predicting FC greater than or equal to 50 micrograms per gram with 70% sensitivity and 61.5% specificity. The authors concluded that patients with moderate to severe HS and serum CRP levels above 5.35 milligrams per liter may benefit from FC screening, and those with FC levels exceeding 50 micrograms per gram may be considered for further endoscopic evaluation to assess IBD.
In another open access paper, Gans et al. Boldly challenged the dogma that psoriasis skin lesions occur before arthritis. Psoriasis skin lesions are generally thought to occur before psoriatic arthritis or PSA develops. However, PSA may be challenging to diagnose in the absence of psoriasis and might be underdiagnosed when occurring before psoriasis. The authors tested the hypothesis that PSA may commonly occur before psoriasis, but without psoriasis, skin lesions is diagnosed as another form of arthritis. A single-center retrospective chart review was performed to identify patients with qualifying diagnoses from January 1, 2023 to December 31, 2023. The study was performed using electronic health records at a large tertiary care medical center. Inclusion criteria were 1, the presence of inflammatory or non-inflammatory arthritic conditions, 2, prior to the diagnosis of psoriasis, atopic dermatitis, or rosacea. Diagnoses were screened using ICD-10 codes. During 2023, the authors identified 2,780 patients with rosacea, 1,672 with psoriasis, and 5,195 patients with atopic dermatitis, of whom 436 had preceding arthritis, 239 with psoriasis, 189 with rosacea, and 126 with eczema. The authors confirmed that arthritic symptoms are common in psoriatic patients before psoriasis develops, and psoriasis skin lesions do not necessarily precede psoriatic arthritis.
Lastly, an original article by Nicholas Ruenes et al. Considered the role of lymphocyte transformation tests and patch tests in identifying drugs potentially associated with bullous pemphigoid development. Bullous pemphigoid, abbreviated as BP, is the most common autoimmune blistering disease, with a rising incidence in the elderly. BP is associated with multiple triggering factors, including drug exposure. However, evidence in this respect is limited, and the underlying immune mechanisms remain unknown. The current study aimed to identify the role of specific drugs in BP pathogenesis using in vitro lymphocyte transformation tests and in vivo patch testing, aiding in the differentiation between truly associated drugs and coincidental associations. 33 patients with suspected BP and no ongoing systemic treatment were enrolled. LTT and patch tests were conducted 3 months after diagnosis. BP disease activity was assessed using the Bullous Pemphigoid Disease Activity Index, or BPDAI, at diagnosis and at follow-up visits at 3 and 6 months. LTT results were positive in 60% of patients for dipeptidyl peptidase, 4 inhibitors, loop diuretics, hydrochlorothiazide, levetiracetam, nivolumab, enalapril, and amlodipine. Patients showed a reduction in BPDAI over the study period, regardless of LTT results. Although limited by the low sample size, positive LTT patients showed a trend toward clinical improvement when the implicated drug was discontinued. Patch testing was positive in one patient, who also had a corresponding positive LTT. These findings demonstrate the existence of a potential role for certain drugs in BP pathogenesis, suggesting that these drugs may trigger the disease in genetically predisposed individuals. Although further studies are needed, LTT may serve as a useful and available tool in the management of BP patients in the future.
This was the September episode of IJD in Focus. Thank you for listening. Until next time.